In this video, you'll discover why some people are dying from the coronavirus while others just have mild symptoms. One of the top questions I've been getting from my patients over the past couple of weeks is why is it that some people are having fatal results from the coronavirus and other people are just having mild symptoms? And that's a really good question, and it's an important thing to understand so that you can protect yourself properly from the coronavirus. So that's what we're going to break down in this video. But before we get started, I'm Dr. Zyrowski and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit the notification bell, and join our notification community. And I'm going to help you excel your health and your life. Let's go ahead and first start off as to why this is happening. Like I said, a lot of people are asking me this question. And one of the reasons for it is, first of all, age has a factor in this scenario. I showed you this graph a couple weeks ago. And what I pointed out is that as you increase in age, basically what's happening is you're increasing your risk of having fatalities with the coronavirus, but also there's some different conditions involved with it. And this is what I really want to focus on during this video, because a lot of people will look at the coronavirus and they think that the virus is just, there's different strains of it. This is what the general consensus of what people are understanding about it is, that some people are getting it so bad because they got a stronger version of it, whereas other people aren't getting it as bad because they got a more mild version of the coronavirus. And that's not particularly the case. What is the case is that your body will react differently based on your health status. And so let's go ahead and talk about these conditions here and how they play a role. So I want to point out that age plays a role, but then let's talk about the conditions here. Now, if you're suffering from another condition when you have the coronavirus, it is something that is to be taken very seriously. And I want to point this out because I've had some elderly patients that are not concerned about the coronavirus, kind of laughing it off. And I've had younger patients that are as healthy as can be that are just totally freaked out about the coronavirus. Okay, that whole scenario needs to switch. And there's a lot of reasons that you have to be concerned if you are of older age, if you're suffering from another condition, and if you're a young, healthy individual, you don't have to be as concerned. But we do have to be concerned with transmitting it to the elderly population who has many of these different conditions. So let's go ahead and talk about these conditions. Cardiovascular disease is one that is highly associated with an increased risk of having severe consequences of the coronavirus. Cardiovascular disease, diabetes, and if we think about this, there's so many people who are suffering from type 2 diabetes, so many. Diabetes, hepatitis B, COPD, or pretty much any respiratory disorder for that matter. I mean, even smokers, like I had mentioned in another video, I had said, I had patients that are smokers and they kind of I'm not worried about it. And based on how I can just hear them breathing and how their respiratory is functioning, it's no, you really need to take this seriously because this could be devastating for you. COPD is a big one, kidney disease, and also cancer. When we look at all these issues, this is a huge percentage of the population, okay? What studies have shown coming out of China at this point is basically that if you have one of these conditions, you have a 79% greater chance of requiring intensive care, a ventilator, or both, or even having fatal results and dying as a result of the coronavirus. Okay, so this is to be taken very seriously. Now, what the studies also show is that if you have 2 or more of these conditions, you have a 2 times greater risk of death, okay? So once again, we have to take in the proper perspective what the risks are associated with your current state of health. And so these diseases right here are associated with having a greater risk of major problems with the coronavirus. Let's talk about fatalities from the coronavirus and what this study from China has actually showed us. And it showed us that cardiovascular disease had an increase in fatality rate by 10.5%, okay? That's a big number. Diabetes, 7.3, COPD is 6.3, hypertension, which there's a lot of people walking around with hypertension right now, 6%, and then cancer has a 5.6% increase in fatality rate if you get the coronavirus, okay? So let's break this down just as what we've talked about so far and reiterate this a little bit. So if you have an existing condition or if you're older in age, this is definitely a greater risk that you may have severe consequences with the coronavirus. Now, the reason for this is because your immune system is not functioning as well. Your immune system is depressed because your immune system acts as an antiviral, an antifungal, and an antibacterial. What happens when this coronavirus hits, it basically just sets off a storm of inflammation into the lungs. It damages your lungs and it creates a syndrome called acute respiratory distress syndrome. And this is a reason that so many people are dying from the coronavirus. And so what we have to do is we have to make sure our immune system is functioning well. I've been saying this from the very beginning when I first learned about this. Now you have to focus on boosting your immune system, and especially if you have one of these conditions or if you're older in age, because your immune system is going to act as an antiviral to fight this coronavirus off, okay? Now, if you are interested in learning more about antivirals, natural antivirals, I did a video right here on a natural herbal antiviral that has been shown to help kill off viruses in the body. And so check that video out. Now, the other reason your immune system is so important is because when it's not functioning right, your body loses the ability to fight off inflammation and viral infections, okay? So like I said from the beginning, this coronavirus sets off a storm of inflammation, and then this virus attacks the body, the immune system isn't functioning well, and then these are the people who are struggling greatly when they get the coronavirus. And so that's the important thing to know. If you want to learn more about natural ways to boost your immune system, watch this video right here. Every time we have this big viral epidemic or pandemic, one of the things that happens is Lomatium dissectum actually starts getting talked about again. It works well. It's been proven through history to work well. It's been proven through science and research to work well.